Now, the fate of cancer and HIV and AIDS patients who depend on drugs supplied by donors continues to hang in the balance. While the government had promised prompt intervention, the drugs are yet to be released by the Kenya Revenue Authority.
Cabinet Secretary for Health, James Macharia, had last week stated that his ministry had paid the tax required to release a consignment of drugs currently detained by the Kenya Revenue Authority.
The idea is to make sure those drugs and medicines reach the people who need them as we sort out the law in terms of waivers.
However, as of today, the drugs had not yet been released. Several patients are reported to have already run out of their drugs and are now hanging on the hope that the drugs will be released as promised and sooner rather than later. The detained drugs consist, among others, of cancer and HIV and AIDS drugs, drugs which are crucial to sustain the lives of these patients.
If I don't get any more drugs, I may go back to the same problems I had. And if I don't have enough blood, then I think I may not last long.
The drugs are supplied by donors to help hundreds of patients who cannot afford them. The Kenyan government recently introduced the Railway Development Levy, which requires the drug beneficiaries to pay 1.5% tax on the donated drugs, a cost they are unable to meet. Their plea now is that the government would swiftly intervene in order to save their lives. Sharon Momanyi, KTN.